Squatting well and squatting often is my second piece of advice in order to improve your pelvic floor health. An old study looked into why Chinese women from lower socioeconomic groups had less incidence of stress urinary incontinence compared to counterparts from higher socioeconomic groups. They found during a post-mortuary dissection that the women from lower socioeconomic groups had more developed pelvic floors with more muscle girth and more muscle length, not to mention that the connective tissue through their pelvic floors was also stronger. What was the difference, and why did these women have such better developed pelvic floors that is seemingly linked to why they had less stress urinary incontinence? Another study done years after that looked into just that in order to find this reason. They believe that this wasn't by coincidence. These women had these results of less stress urinary incontinence and stronger pelvic floors because they worked harder, they had less obesity, and they were squatting more. This tells you how important squatting is to our pelvic floor health, our pelvic floor strength, and why we should continue to squat and squat well in order to better our pelvic floors all around. Squatting has countless advantages. From a pelvic floor perspective, squatting can help with a multitude of different things, from decreasing straining when we're voiding, actually reversing hemorrhoid development, in addition to decreasing pressure on the uterus and the low back. Squatting can also improve the ability to decompress our thoracic spine and our lumbar spine by having better function of not only our pelvic diaphragm, but also our thoracic diaphragm through squatting. We all have heard of all the cons or negative things that squatting can entail, from creating more low back pressure and pain, more pressure through our knees, all those different things. We also know that if we don't squat well or overload our squat where that load exceeds our tissue capacity, that squats can lead to pain in our back, hips, and knees. Moral of the story here is we must mitigate these cons of squatting and take advantage of the pros of squatting by squatting well in different positions and knowing what we're doing when we're squatting. Here's a couple different variations of a squat to try out. This first position that we're gonna do is gonna be a heel elevated squat that we're gonna focus on the inhale and getting breath in through our pelvic floor, but also a lot of our breath in through this posterior aspect of our rib cage as we squat down. And then as we exhale and stand up, we're gonna think about pressing those heels through the ground and lifting with our pelvic floor as we exhale and use those glutes to stand in addition to that lift of our pelvic floor. We're gonna cue this from this position. We're gonna start with a little bit of this posterior pelvic tilt just to get set up in a good way. Now from here, our heels are slightly elevated on some wedges. The front of our foot is just relaxed on the floor. From this, I'm gonna just ask you to slowly start to sit your hips back into a squat position as we inhale on our way down. Good, and as we inhale, that pelvic floor is gonna drop, that breath is gonna go more into our back here. Now as we exhale, we're gonna push that ground away through the heels and have that pelvic floor help us lift as we come up from that position. So if we look at this one more time, we're gonna sit into our squat as we inhale, feeling that breath expand through our pelvic floor and also through the posterior aspect of our rib cage. And we're gonna exhale as we push that ground away and lift up with our pelvic floor, in addition to using those glutes to help us stand. For this version of a squat, we're gonna be prefacing a little bit more of our posterior chain and sitting into our glutes, but we're also gonna be using our abdominals in order to keep our spine in a great place, but continue to build capacity there in stabilization. From this position, we're gonna have a band anchored to something that is nice and sturdy, or we can use a cable machine that's gonna be at about hip level to start here. Now we're gonna begin by pulling on that band and placing it right in front of our belly button, and it's gonna stay right in front of our belly button throughout the entirety of this exercise. The only way that it's going to be moving is out and back in. In this position, we're going to sit into a nice squat by more so thinking about sitting back into our hips like we're sitting down into a chair instead of reaching our knees forward for this variation. As we start to sit back into our hips, we're going to exhale and push that band away from us. We're going to feel that deep core active as we feel our glutes here. Then as we inhale, we're going to start to push that ground away from us and power up through using those glutes in order to do a squat with a little bit of this resistance in order to get our abdominals engaged as well. For this exercise, we want to make sure that we get an equal pull of this band from our left and right side to develop those left and right obliques equally here. Once we have done about 10 or so repetitions here, nice and slow and controlled, you're just gonna turn around. We don't have to anchor that band in any different way. Facing the opposite direction is an easy way to, again, get that line of pull and do the exact same thing here, sitting into those glutes as we press that band away and exhale and standing up, pushing that ground away always feeling like our legs are active both as we're sitting down into this motion and pushing that ground away from us in order to stand, just with a little bit of added resistance to engage our abdominals in the squat position.